Radiation therapy as an adjunct or as an adjuvant to surgery, alongside immunotherapy and other emerging therapies for non-melanoma skin cancers, has a very important role to play, and that's probably the majority of the use of radiotherapy as well. What that means is if a patient has a lesion excised, and there are a couple of high-risk features, things such as perineal invasion greater than 0.1 millimeters, recurrent lesions, lesions in immune-suppressed patients, poorly differentiated lesions, large, thick lesions. Those are the risk factors for recurrence, and that's where we use radiotherapy to prevent the recurrence. Now, if you add surgery and radiotherapy together, your recurrence risk is reduced to under 5%. And that's a relative discussion with the patient to say, we could give you radiotherapy now to prevent a problem in the future, or we could see how you go, and if a problem occurs, we have to then tackle it on its merits later on. And that's a risk balance that we have a discussion with the patients. The next level of where radiation therapy is useful is, and certainly absolutely indicated, is when you have tumours that are spread to local lymph nodes. Now that applies to squamous cell carcinomas, not generally basal cell carcinomas. But if you have a squamous cell carcinoma that has spread, you need to remove it surgically, and then you have to give postoperative radiotherapy for recurrence risk prevention. The recurrence risk without radiotherapy is high, it's over 50%, and radiotherapy has a lot of value to add to that patient. Again, it's got to be balanced on the patient's general health. On top of that, we're now seeing the emergence of immunotherapy as an option, not yet approved and clinically proven, but certainly many clinical trials happening to say, if we were to give immunotherapy alongside radiotherapy after surgery, is there value in that space? And right now that question is in the process of completion of several large international randomized trials in this space. The other role of radiotherapy in the adjunct setting is really in the metastatic setting. That is, when tumours have spread, we see them as incurable, but we want to help the patient control the tumour and have a good quality of life. And the radiotherapy has a very useful role in that setting, and definitely immunotherapy has a PBS TGA, evidence-based approved role in Australia.